Hi, I'm Dr. Pamela D, and welcome to another episode of Answers. Today, we are going to talk about low libido and what to do about it. I know that this is going to be one of the most watched episodes because this is a ubiquitous problem in gynecology. It is the number one question that I get on my website and in my office. What happens to us? We're dating, we can't wait to see our partner, and we get married, and you enter what I call the jungle sex part of your marriage, where all you can do is run to the bedroom and rip your clothes off, and you just can't wait to be together. And you have so much sex during that first year. It's amazing, maybe even the first couple years. But then what happens to us? Well, we get jobs, we have children, our husbands get jobs, and we have to do so many things to make a marriage work nowadays. One person really can't have a job unless you're making an enormous amount of money. Both spouses have to be working. That puts such an added stress on a marriage. Children are tough. I have two of my own. They take up a lot of time. And we seem to feel obligated now to fill every moment of their waking hours with constructive activity and keep them out of the streets so they don't get involved in alcohol and drug use. We have every part of their day mapped out. Somehow in there you have to make dinner, you have to get the laundry done, you have to get the chores done. It is consuming. And by the time you get into bed and put your head on the pillow, the last thing you're thinking about is sex. Now, my understanding is that most men think about sex a lot. And it's a big difference between men and women. Our lives are so full now of so many things, especially with children at home. And then you finally get to a point that they are driving and you're not the taxi mom anymore. And thank God carpool is over because the kids are driving themselves. And you find yourself with really an enormous amount of extra time, especially after the kids leave for college. After that last one is gone, you are alone in your house. You may have a little bit of an empty nest syndrome going on, and worried and upset about them, and worried that they're making good decisions. But eventually you're just going to settle in and realize, I'm at home with my spouse and we have this extra time, and finally you can put some effort into your marriage. Well, why do women get low libido? One of my closest friends and mentors, Dr. Michael Critchman in California, who taught me my medical sex therapy course as well, has a great saying. He said, it's not the what, it's the why. Why aren't you having an increased libido? Or why is your libido gone down? The first thing as a physician we have to do is find out why. Is there something wrong at home with your relationship? Are you harboring bad feelings of, he didn't help with the children enough, maybe he drank too much, maybe he worked too much and you were home with the children alone? Why do you have a lower libido? What is it? If there is a reason, either a psychological reason, a relationship issue, a marital issue, there's some overlying problem in your marriage, maybe financial or mother-in-laws or something. But if there is not a psychological relationship medical problem or emotional problem reason that you have a low libido, you may be suffering from hypoactive sexual desire disorder, or HSDD for short. That's hypoactive sexual desire disorder. Once we have evaluated you and you really don't have a reason to have a low libido, then we can talk about the medications that can help. If you do have a reason for your low libido, such as harboring bad feelings about your marriage when the kids were home, it may be better to get some counseling, and especially marital counseling, to see if you can resolve some of those issues. Can you forgive those issues? A lot of times men come in with their wives and say to me, you know, I wasn't as good as a husband as I could have been, or a father as I could have been, but I love my wife and I want to start over. I want to renew our relationship again. I want to date and take her out, and I want to come home and make love to her. But these bad feelings are being harbored by the wife in the relationship, or it could be the other way around. If you need counseling, if you need to learn to forgive, then get it. Get it. That is always going to stay in the forefront of any sexual relationship. Women think too much. We are always thinking about what's wrong and why we may not want to be there right then. If you have a medical issue, get it taken care of. Diabetes and hypertension can affect libido. Being on hormones such as birth control pills in the perimenopausal era can decrease your libido. Hypothyroidism, if your thyroid gland is not acting appropriate, it may cause you to have a lower libido. Chronic illness can cause a lower libido. And probably one of the most important things I have to say that women say that's causing their low libido is body image. They're overweight, they hate how they look naked, and they are never going to let their husband see them naked. I have had women who tell me that they have not been alone, naked in a room with their husband in years. That their husband has not seen them naked in years. And they're the ones preventing that. They say, he doesn't care what I look like. He tells me he doesn't care. He thinks I'm beautiful, but I know that I'm not, or I feel that I'm not, so I can't let him see me. I don't know what to say about that, except maybe get on the ball, get on a great exercise and diet regimen, go to Weight Watchers, start walking, do something to improve your self-image so that you feel good about yourself again. I had one woman write to me that her hair has been falling out for several years and now she has to wear a wig. She's humiliated and she doesn't want her husband to see her without her wig on. And she said, every doctor I've seen says, your hair is not you. And she said, I don't want to hear that anymore. I am not me without my hair. I wish I had a great solution for her. Her body image is getting in the way of their intimate relationship. Maybe counseling will help. Maybe something for hair loss will come out that will help us feel better about ourselves if you have really low hair volume. Maybe something will come out for weight loss if you feel badly about yourself. Those things causing your low libido are not going to be fixed with a pill. There's just not a pill for that. And so I start this out by saying, if there is a problem, a bad feeling, a self-image problem, a resentment problem, do what you got to do to get it fixed. If you can't just start over, then get some help, because you got a long way to go here. If you're 50 years old, you're going to live to 90 years old. The life expectancy is the mid to high 80s for people now. So you're going to be together another 30 to 40 years. A non-intimate relationship for 30 or 40 years is very sad. And you may be able to fix it with some counseling, forgiveness, weight loss, a great wig, hair implants, I don't know. But whatever it is, admit it to yourself and do it. So, we get to the point where I, as a physician, say, I agree with you. I think that you have hypoactive sexual desire disorder, or HSDD. And you have a low libido. We can't really identify the problem. An example would be a woman coming in and saying, I have a great husband, he loves me, I feel good about myself, I've put on some weight, but I'm really happy, my kids are great, and they're moved on to college or beyond, and I'm not overworked, I really have nothing to be worried or stressed about, I just never think about having sex. Well, there are two options for this type of woman. So one is an off-label treatment, and one is an FDA-approved treatment for low libido. I'm going to start with the off-label use of testosterone for women. Now, many women come to me and with all of these testosterone levels, that's fine. I know if you are menopausal, your testosterone is going to be low. Unless you have some type of testosterone secreting tumor, it's not going to be high. So we can assume that it's low. I do follow testosterone levels when I put somebody on testosterone, especially higher doses, just to make sure I'm not getting too high and I'm going to hurt them. As a physician, our first line of business is to do no harm, to not hurt you. We'll help you, even if it has to be an off-label use of a drug, but none of us want to hurt you. And so we have to watch that with levels to make sure it's okay. So testosterone is approved for men. It helps with energy levels, with motivation, and with desire to have intercourse for men. Men can actually inject testosterone right into their penis to help get an erection. Unfairly and sadly, men have 26 drugs to help them have an erection, which helps them improve their libido. Women don't work like that. If all we had to do was get our clitoris engorged with blood, it would be a lot easier. But we got to get our head around it. We got to want this person. We got to want to be with them and let go and be naked in front of them. What can help with that? So testosterone does increase overall feeling of well-being and motivation in women at high doses. The problem is the side effects of those high doses can be a very much of a turnoff for women and for your partner. Side effects of testosterone use are acne, increased acne and acne on your back, whiskers, which we already have a problem with, where I'm sure you, as I, am already plucking these rogue whiskers that grow overnight on your chin and maybe on your upper lip. To take a medication that increases that seems horrible, but if it increases your libido and it helps your marriage, it may be worth it for you. So acne, increased growth of hair on the face, male pattern baldness, which is the receding hairline, increase in your cholesterol, and at very high doses your clitoris can enlarge and your voice can deepen. Those two side effects are not reversible. If you stop testosterone, your whiskers will go away, your acne will go away, your hair will grow back, your cholesterol will come down if those side effects happen to you. But if your clitoris enlarges or your voice deepens, that is not reversible. So please be aware of that. I have had one email from one of you on my website where they were getting testosterone from a personal trainer in male doses, and her clitoris enlarged, and she wants it to go away. From what I understand, that does not reverse. So please be careful and get your testosterone from a reputable source. So if a woman says, okay, I'm willing to take those risks, and you have a doctor monitoring you so that you don't get bad side effects, then you can take testosterone. It is off-label. It is not FDA approved. You have to get it from a compounding pharmacy, or you have to use male testosterone in about 1/10 of the dose. There's not a great way to titrate it in women. For instance, there's one testosterone that men use that's called Testim, and it's a tube, a gel of testosterone, and they rub it on them one a day. Well, for women, we have you put 5 pea-sized drops on your arm and rub it in once a week. It's really hard to know if you're doing it right and getting enough, which is where levels can come in. If you are feeling better and hornier because of the testosterone and your testosterone levels are still low, nobody will be happier than me or your physician, because we don't want to hurt you. If you get medication in a compounding pharmacy, you really have to trust your pharmacist. Now, I have 3 compounding pharmacies near me, and I know the pharmacists very well. I'm in contact with them a lot. I don't think they're going to cheat my patients, and I don't think the patients feel that way either. They have a business to run, and they're honest about it. You do not have the quality controls that you do in a medication manufacturing plant, where we assure that the same amount of drug is in each tablet or pill or spray or whatever you're using, and the quality controls for safety and contaminants are not there as well. But if you're just going to use it topically, like a topical testosterone, I think it's very reasonable, and it's much cheaper than using an FDA-approved testosterone at a dose for women. You'll really have to talk to your physician about that. So, off-label use of testosterone in the amount that your physician feels comfortable giving you, and be aware of the risks using testosterone in women of whisker growth on your face and neck, acne on your face, neck, and back, male pattern hair loss, increase in cholesterol, which obviously can lead to stroke and heart attack, deepening of the voice, and enlargement of the clitoris. The doses that I give in my office are fairly low, and I will go up monthly if the patient feels like she needs a higher dose and her levels are not too high. To be honest with you, I really haven't had anybody on topical testosterone have a testosterone yet that I was worried about. I have used testosterone orally in some women, and I have used an injectable in some women. I'm a little more cautious about the doses when I'm using an injectable testosterone. If after 4 to 6 months she has no benefit from the testosterone, I stop it. Especially if I'm at higher levels. If it's not working, it's probably not going to. There's a reason testosterone is not approved for women in the United States. There have been many clinical studies that just haven't shown a benefit. There was a testosterone patch available in Europe for several years, but about a year ago it was taken off the market voluntarily, and we really don't know why. I don't know if there were some side effects or they were worried about lawsuits. I just don't know what happened. But we have had many clinical trials in this country on testosterone for women, and unfortunately they just have not shown a benefit yet, at least not one that the FDA will approve. So that is your first option, is topical, oral, or injectable testosterone. There are also pellets that you can inject into your butt, into a fatty area of your body. I tend not to use the pellets. I've never used them in one of my patients. The North American Menopause Society really feels that a steady state of this is better, and the pellets and the injections tend to give you a steroid high and you crash. You need higher doses and then you need them more often. It's better to just give it topically and at a steady state. But again, testosterone is not approved for women in the United States. What's the next option? Well, there is one. It's hard to believe it took this long to get here. There is one FDA-approved drug for low libido in the United States. It was approved by the FDA for sale in the US around November of 2015. So we have almost 2 years under our belts now. I have not heard of any adverse effects at all, to be honest with you. This drug is called flibanserin. It goes by the trade name of Addy, A-D-D-Y-I. Addy was found by accident. I'd like to regress a little bit and talk to you about another well-known drug that was found by accident. About 25 years ago or so, the drug Rogaine, or minoxidil, came out as a new blood pressure medication. And it went to phase 3 clinical trials, and you had maybe 10,000 people on the drug, 10,000 on placebo, and then they switched them without the patients knowing it, and you don't know if you're on the placebo or the drug. Well, nobody's blood pressure got better. The drug was a failure as an antihypertensive. So they stopped the study, and it didn't come out. Well, when they stopped the study, men were coming to the people who were doing the clinical trials, and they said, look, I want this drug. My hair is growing. I was bald and now I have hair. So that happened so much that they realized that they had a drug for hair loss in men and in women. So minoxidil now first came out as a prescription for hair loss. I should have looked this up, but maybe in the 90s or something. And now it's so safe for your blood pressure, it has actually no effect on your blood pressure, that it's over the counter now in any pharmacy. And you can take it right off the shelf. So this drug was found by accident. Addy was also found by accident. The company Sprout Pharmaceuticals was developing this drug for a new antidepressant. And they got all the way to phase 3 clinical trials, which is trials on humans, and they had women on the drug, some on placebo, and then somewhere during the study it crossed over, and the doctors and the patients did not know if they were on the drug or the placebo at all. Well, the computer shut down the study because nobody's depression got better. It's a drug that works in the motivation and reward center of your brain. but it didn't do much for depression, so the study was shut down. Well, they had couples and women coming to the clinical researchers begging for the drug, that their sex lives had never been better, that their relationships had never been better, and even had women sobbing, begging to buy this medication so that their intimate relationship could continue the way it had been during the clinical trial. Well, these researchers realized they had something there, and they had found potentially a new drug for libido in women. So they resubmitted it to the FDA, just like Rogaine or minoxidil did, and it was approved for low libido in women. Now, they had to go through a lot of extra hoops to get this drug approved, and they passed every test. Right before this drug was approved, the FDA made the researchers at Sprout Pharmaceuticals do an alcohol intervention study. And it was only on 25 people. They were about 150 pounds. And the study was such that they had to wake up in the morning, eat a very light breakfast, if at all, and take the flibanserin pill first thing in the morning, and over 10 minutes consume 2 or 4 glasses of wine, 2 or 4 beers, or 2 shots of 80 proof grain alcohol. And let's just say half the people needed some medical attention. I believe it was six people needed medical attention because their blood pressure got low, and I think 6 people fainted. So in order to prescribe this drug, the physician prescribing it and the pharmacist who fills it has to be part of a certified program that you counsel the patient that you have to take the drug right before you go to sleep, preferably even having it right next to your bed, getting in bed and drinking it then. You cannot drink alcohol with this drug. You have to call your healthcare provider if you feel faint or faint while taking this medication, and stop it if you have these symptoms or side effects. That study has really put a damper on patients wanting this drug. I think that women who do have a job and come home and do most of the activities at home enjoy their glass of wine or beer or their toddy when they get home, and they're really not willing to give that up. I do not work for this company, and I'm not promoting alcohol use with it at all. I think that's a little bit of a tough recommendation. If you can drink that much first thing in the morning over 10 minutes, you probably have an alcohol problem. I don't know that it's the Addy that much as it is the alcohol, but it only happened in people who combined the alcohol and the Addy. So clinical trials are clinical trials. It was only on 25 people, and you cannot drink alcohol with this drug. So that may have turned you off to it right away. If not, then the next part of the story is that up to 60% of women will respond to this drug. Only 60% of women are going to respond to this drug. It came out as an antidepressant. So not everybody responds to every antidepressant. If they did, then we wouldn't need more than one antidepressant. But some people respond to Prozac, some people respond to Paxil, some people respond to Wellbutrin, and they have no response to anything else. Everybody's a little bit different. For some reason, only 60% of people respond to this drug. in the people that respond to it, they can have up to a doubling of their satisfying sexual experiences. So if you're having sex once a month, it may go to twice a month. Twice a month, 4 times a month. Once a week is very tolerable for a lot of spouses who were not having sex but once every 2 weeks. So it can double your satisfying sexual events if you respond to this drug. Now, I have many women who never miss a refill of this drug, and I have some who never asked for a refill after the 2 months I initially gave them because it didn't work. The people who respond with an increased libido to this drug love this drug. Now, up until March 1st of 2017, this drug was $850. So it really was out of reach for most of us. But the price came down to $150 a month in March. And there is a $25 coupon that works for some months. So if your insurance works with this and a prior authorization works with this drug, you could get it for $25 a month. If it works, if you gave it $50 or $75 shot and you're one of the responders, this would be well worth it, even at $150. If it changes your life and changes your marriage and your husband is all of a sudden happier because of your desire to have sex, then it may be worth even more than that. I don't know. But you'd have to try it. So the $25 coupon for $25 a month is key. If not, it'd be $150 a month. That's a bit unfortunate. I think if they lowered the price really low, that every woman in America over the age of 40 would probably try it, and they'd probably make more money, but nobody called and asked me. So I hope this has helped, and I hope it gives you kind of little understanding if your doctor hasn't gone into this much detail. We hardly have time to examine you and ask the questions that we have to ask during an annual exam or a problem visit. It is very difficult to explain all this, the side effects and risks of these drugs during any normal visit. I've probably been talking 30 or 45 minutes and I'm already thinking of some things that I forgot with both of these. But for women with low libido who have hyposexual desire disorder, in that there's no reason for their low desire, they just have low desire, we have testosterone, which is not FDA approved for women, and we have flibanserin or Addy, which is FDA approved but only works in up to 60% of women. Hopefully, as the research continues, we will have more drugs to help women. Just like we have lots of antidepressants, we may get lots of different medications that work in various parts of our brain to help us want to have sex again at a what our husband thinks is a more natural level. What's nice about the Addy as well, something I forgot, is it decreases your distress about not wanting to have sex in 20% of people. So if you're significantly distressed about the fact that you have low libido, taking Addy can actually decrease that distress. Another bonus. So those two drugs are really all we have. The main thing is to ask yourself why. Why do you have a low libido? What is going on in your marriage, in your finances, in your memory banks that make you not want to have sex? Is it just with this person? Do you want sex with another person? When you go to a hotel and get away from children and a normal environment and get on vacation and away from work, does your sexual life increase greatly? Well, then it's probably stress. So this is a difficult topic to have. It's almost impossible to have this discussion in a good way in an office visit that may only be allotted 15 or 20 minutes at most. If you're on especially higher doses of testosterone, then you're going to have to get some levels drawn, but usually we don't need levels before you start it. I sure hope this has helped you all to understand what women can do for low libido and what the causes of low libido are. I hope I've explained it well. And if you have questions, please contact me through my website, drpamelad.com, and I will get back to you as soon as I possibly can. I'm Dr. Pamela D, and thanks for tuning in to another episode of Answers.